Ovarian cancer. Causes, symptoms, and effective prevention. 1. Causes. Ovarian cancer occurs when cells in the ovaries grow abnormally. The exact cause is unknown, but risk factors include genetics. Mutations in the BRCA1, BRCA2 genes or related genes, Lynch syndrome, increase the risk, accounting for 10 to 15% of cases. Family history of ovarian, breast, or colon cancer. Age. More common in postmenopausal women, especially over 50 years old. Reproductive factors. Not having children or having children late, after age 35. Early menstruation, before age 12, or late menopause. Use of postmenopausal hormone replacement therapy, long-term. Medical history. History of breast cancer, endometrial cancer or endometriosis. Lifestyle. Obesity, a high-fat diet, or smoking may increase your risk. Environmental factors. Long-term exposure to asbestos or talc, used in the genital area, although controversial. Note: not everyone with risk factors will develop the disease, but those at high risk should be closely monitored. 2. Symptoms. Ovarian cancer is often called the silent killer because its early symptoms are vague and can be easily confused with other diseases. Common symptoms include abdominal or pelvic pain, a feeling of heaviness, dull pain, or cramping in the lower abdomen, bloating or indigestion, a feeling of fullness that persists even after eating a small amount, changes in bowel habits, constipation, diarrhea, or frequent urination, unusual fatigue, unexplained weight loss, poor appetite, or persistent fatigue, pain during sexual intercourse, irregular menstruation, abnormal vaginal bleeding in postmenopausal women, abdominal mass or swelling. In the late stages, a mass or abdominal swelling due to fluid accumulation, ascites, may be palpable. Note: symptoms are often obvious in the late stages, check 3-4, when the disease has spread. If symptoms last more than 2 to 3 weeks, you should see a gynecologist immediately. 3. Effective prevention methods. There is currently no way to completely prevent ovarian cancer, but the following measures can reduce the risk. 1. Regular health checkups and screening. Women at high risk, family history, BRCA mutation, should regular gynecological checkups, transvaginal ultrasound, and blood tests to measure CA-125, cancer marker. As consult your doctor about genetic testing, BRCA1, 2. Normal women should have an annual gynecological examination to detect abnormalities early. 2. Use of oral contraceptives. Using oral contraceptives, as prescribed by a doctor, for 5 years or more can reduce the risk of ovarian cancer by up to 50%. However, you should consider the benefits and risks with your doctor. 3. Childbirth and breastfeeding. Women who have given birth and breastfed have a lower risk. Having children before age 35 helps reduce the risk. 4. Preventive surgery, if high risk. Women with a BRCA mutation or a strong family history may consider removal of the ovaries and fallopian tubes after completing the childbearing plan. Hysterectomy in some cases. This decision should be discussed carefully with a specialist. 5. Healthy lifestyle. Diet. Eat lots of green vegetables, fruits, limit saturated fat and processed foods. Maintain weight. Lose weight if obese, BMI or 30, to reduce pressure on the reproductive system. Exercise. Regular exercise, 30 minutes, day, 5 days week helps improve overall health. Quit smoking. Quitting smoking helps reduce the risk of cancer and improve health. 6. Limit postmenopausal hormone therapy. If hormone replacement therapy is needed, use the lowest dose and for a short time under the supervision of a doctor. Note: early detection. Early-stage ovarian cancer has a 5-year survival rate of over 90%, but most are diagnosed at a late stage. Screening in high-risk groups is very important. Medical advice. If you have a family history or are concerned about your risk, consult your gynecologist or geneticist for advice. Thanks for watching the video. Wish you and your family health and happiness.